We've got a number of questions to kick you off, and then we'll have a look also on other questions that are coming through Hoover. So audience, get busy if you've got things in there. Remember, you can vote up a question if you like it, and it's more likely to get answered because we do take them sort of from top down. But in the meantime, I'm going to start with, what is the one thing that you would change about the system overnight if you could? And that's a great question to start on. So I'm going to ask each of you that one. So just thinking again, what is the one thing that you would change about the system overnight if you could? And Ryan, I'm going to start down your end just so.
I was hoping I would go last, but okay. Look, it's hard because there are so many things you want to change with the system overall. I think, for example, there's lived experience needs across every single area, and I think if I had to do anything, we'd be looking at creating a department of lived experience and looking to how that could actually help to change and to work as a starting from the top and continuing to work downwards in the different systems, which will help to create the diversity of roles peers need, for peer educators, to peer leaders, to senior peers, to research, education, to whatever's needed. So I think those sort of options will really help to create the needed structure from the top and help to influence change, which will have trickle-down effects through the whole of the system.
I feel like I should have a genie. You know, when you pull out the genie and you get the one wish and then you wish for more wishes. I think probably at the systemic and the individual level, reducing stigma and discrimination for peer workers. So I know that there is the National Stigma Discrimination Reduction Strategy. I'm not sure how much of it covers peer workers, but if there was one wish, it would probably be the reduction of stigma and discrimination at the systemic and personal level.
So for the peer workforce or in mental health service in general?
Oh, you can go with either if you want to.
So in mental health service in general, I would say if I could change something overnight, it would be to make it completely voluntary so that our system becomes about choice, not force. So I think that's the most important thing that I could think about for change.
Thanks, Jemima. Chris?
Hard to compete with those answers. That's awesome. I think for me, for the peer workforce, I think it's about accountability and consistency. So, you know, having consistent approaches across the board, and then accountability for those things to remain intact and for things to feed up to the levels in which we need, and then accountability to actually act on that and not just when it suits people.
Well, thank you. Next question is kind of like, what is your greatest? But you've got options here, so, and I'm not going to ask, I'm going to get you to pick one. So it's going to be your greatest assistance in doing your job, greatest obstacle, or greatest frustration. So just a little ponder for a wee moment. Greatest assistance, greatest obstacle, or greatest frustration? Brian, you got one? Go.
Look, I think greatest assistance probably, look, we have so many different people across our whole district, the whole of New South Wales Health, and I think being able to tap into the knowledge and expertise of other peers in other areas has been really good to look beyond the borders of our own local area, our own local district, our own organisation, and so just tapping into that wisdom and knowledge. I've seen peers come across from peer stock in different areas, so we want to speak to other peer stock workers, Aboriginal mental health peer workers want to speak to other Aboriginal mental health peer workers, and I think senior peer workers want to speak to other senior peers as well. Tap into that collective wisdom so we can tap into the whole power of the whole peer workforce in the room and in the whole workforce versus just in particular areas as well. So that's probably been tapping into the entire power of the peer workforce, which I think has been the best support for a lot of people.
Yeah, thank you. Evelyne?
So I think the biggest obstacle that our CMO peer workers are responding to are a couple of things, but the opportunity to network with other peer workers in CMOs, both within their own organisation and then across organisations. It often feels like the peer workers have to lead that initiative rather than something already existing that they can tap into. Ratios, that peer workers are overwhelmed and outnumbered, I guess, in terms of the number of clients and consumers that they're supporting and servicing, and just the number of peer workers, that there aren't enough peer workers to take into account the number of consumers or clients or participants, depending on which program you're in, that they service. And probably, obviously, just because we've finished the peer supervision presentation, is just the differential peer supervision, whether it exists or doesn't exist, and the quality of it, it's quite variable. So, yeah, peer workers are looking for more supervision, more support, more mentoring, and probably that internal culture of driving peer workers as not just something as a nice to have, but something that's a must have and central to the work that CMOs do.
Thank you, Evelyne. Oh, there's some enthusiasm around that. Jemima, you're up next.
Can I do like a positive and a negative?
Yes.
Okay, so the positive thing that helps work is all the peer workers and all the consumer and care advisors and the passion that they bring. There's nobody at my work who's not there because it's their life passion and desire to be there to make change and to do good work in the world. So that makes me want to come to work. The negative thing in the public health sector is like rampant neoliberalism from the terms of the government in making it really impossible for us to do our jobs, doing things like stopping us from hiring people for 6 months and then blaming community mental health sector for being inadequate when we're not actually adequately supported. So yeah, that's what makes me really sad, is because that squeezing of those dollars is impacting people's mums, people's dads, people's brothers and sisters, and it makes me sick.
So Chris, you can pick any of the above.
Yeah, I think the greatest assistance that I've really had is just having a really terrific mentor, Faye Jackson. Shout out to her. I think that's just having someone who has been able to, be a bouncing board and be able to share the experience. I think mentorship and, supervision in that space, I think has been informal and formal. I think it's been really the biggest assistance to my growth and actually knowing how to then do that for others. So.
Yeah, thank you, Chris. We've got 3 questions that are coming up next, and then because we're doing really well for time, we should be able to get to the Hoover ones, which would be a bit exciting for us. But these ones are related to, so again, just sort of casting through your mind which one you might like to answer. This is the challenges of peer worker isolation, what clinical colleagues need to understand, and support needs for CMO versus government. So I'm going to ask them one at a time in more length, but that's what you're looking at there. So have we cast your mind over which one you'd like to jump in on? And I'll start again. What kinds of supports would help you to manage the challenges of peer worker isolation in the workplace? What do clinical colleagues need to understand about peer workers? And are support needs for peer workers different in the CMO and government mental health sectors? Have you picked one?
Oh, I'm starting again.
Go on, Ryan.
Look, these are all really big, really huge questions, and they're actually really meritable and have, it would be great to actually continue to explore each of these. In regards to, I guess, the clinical colleagues understanding about peer work, I think there could be more education while they're actually in university and studying to actually understand peer work overall. And I think that will start at a very fundamental level from understanding it, exploring it, being curious about it, maybe even doing an assignment or two on it, to even look into the peer research, the peer value for it. And I think that'll come in changing mindsets originally rather than coming into the workforce and being like, oh, we've got peer workers, what are they and what do we need to do, and changing that dynamic. And I think from there you can look into even, for example, mandatory training, heady modules, which could talk about what peer workers actually do, what their value is, in-services on peer work, even making things a bit more for reality. We have really great, amazing documents like the National Peer Workforce Framework. We've created regional peer work frameworks. But I think, for example, a lot of clinicians, when they say, what do peer workers do? They don't really understand that, and I think sometimes referring people to documents which people who have a clinical mindset may be more attracted to, like, oh, there's a framework, there's evidence, there's information about that, I can refer back to it. It's not just a question I ask you on a Tuesday and I forget about it on a Friday. I can actually go back and continue to understand that. So I think finding ways to make it a reality. I think I heard a really good perspective by someone who actually translated a national framework into a brief in-service to make it a reality, to actually show what does it actually practically mean. And I think, that's really powerful because that's actually a way to make things real for people. Like, what does that actually look like? And when you do small, short in-services to people, to clinicians about peer work, the value, stories, as Rose said, was amazing. That the power of peer stories is so transformative in regards to where you came from and what you're doing. So I think those are some ways to help. But the biggest thing is, someone said this to me when I first started peer work. They said, just keep turning up every day. And when you do, from people observing you, and how you work, they'll actually see the changes, because you by yourself are breaking some of those models. You're demonstrating recovery. You're showcasing what that actually is overall. And I think when people continue to do that, we've all been through a lot of different stigma in different areas and comments and things. And I think, some people said, it always surprises us whenever we see you because you're always breaking the model that we're so used to. And it was surprising people would actually have, the audacity to even say that. But it shows that that's the cultural belief sometimes, is that we don't even think recovery is possible, just be in that sick role. So actually, the fact that we're actually continuing to recover, to thrive, to live a meaningful, purposeful life is a good way to actually continue to make that change occur. Again, it's just as Rose said as well, we're not responsible for change in organisations, but we can contribute towards it by just being ourselves.
Yeah, thank you, Ryan. So peer work, we're up, and thank you for answering the clinical one, but just as by way of a reminder, supports for peer worker isolation is the other one, and differences between the CMO and government sectors.
Thank you. I'll probably just talk to the peer isolation. I know that when I worked for a community managed organisation, which was a national organisation, one of the key things I did was lead the development of the peer worker framework for that organisation. But it was, to what I spoke to earlier about the culture and the leadership, it needs to start from the top. So it wasn't just about engaging my immediate manager, it was about engaging the CEO and the entire board so that they were on the journey from the onset about what did we want to do, what was the value of it, and bringing them through that journey. But in terms of reducing isolation, other than obviously supporting peer workers, it's just about supporting non-peer workers so that they understand the value that peer workers do, their recovery journey, what that looks like, and just making sure that shared knowledge exists as a constant so that when you've got team meetings, if there's clinical meetings, you need to have peer workers sitting at the table, and any meetings, any management, there needs to be representation of peer workers. One of the feedback we often get is interviews, for instance, that interviews are conducted without peer workers being present. So again, it needs to be kind of embedded and not just tokenistic. It needs to be absolutely front of mind in everything that we do. Is, okay, so we're just about to launch a workforce in Mental Health Coordinating Council. We're about to launch our workforce survey. So what does that mean for peer workers? How can we engage peer workers as we're developing the surveys, etc.? So just having it front and centre, I think, helps to reduce that isolation. And I'd have to say events like these, I know that it's been off for a couple of years because of COVID, but hopefully people are seeing the value in opportunities like this. I was on the forensic table with Andrew and Mark yesterday, and Andrew was talking about forensic patients as they're exiting, and then Mark jumped in to say, oh well, I've got a consumer who's about to exit, can I connect with you? And it's like, brilliant, this is what forums like this are all about. So it's great that this happens annually, but then how can we maximise that to occur at a local level, at a regional level, amongst CMOs where peer workers exist? So there's lots of opportunity, and we just need some leadership to drive it. And you know what? The champions are in this room, so we're not going to wait for people to come and do it for us, or let's get on with the show and lead it ourselves.
Ryan's going to jump in now. I can see it. Go.
Sorry. Look, thanks, Evelyn. I think that's actually a really good, just a quick point in regards to that. I think, for example, in the regional area that we have these things called peer work networks. And these peer work networks bring together peer workers in the community managed sector and the public sector, because you need to know who your neighbours are locally. Like, you need to know in your local community who are those people you can refer to. And when you actually know that in your local areas, then you can actually form those immediate connections. Because sometimes in these forums, look, it's good, these connections are amazing, and this networking is hugely important, but it's a bit of a lottery. And you don't know who's who and where they're at and what will be effective or not. But when you find out in your local area who's actually working there, if that's what you mean, because that's the bulk of your referrals, right? They're all local in your own area. So when we actually did that, the good thing is peer workers in the public sector and CMO sector came together, worked out services, understood services. They still didn't understand what different organizations even do. What does GROW do? What does Flourish do? What are different programs? What does the public sector have? What does Towards Zero Suicide have? So there's a lot of information sharing backwards and forwards, and I think that actually helped people to have those referrals, have those connections, and I think you need to set that up locally wherever you are in New South Wales. And I think while we do that really well in particular areas, in Illawarra and Southern, I'm not sure if that happens consistently in different parts of New South Wales, and that's probably something I'd encourage people to look into setting up locally in different parts, which will make it a reality for better consumer care everywhere. So,
fabulous, thanks, Ryan. Jemima, you're up next. Which one did you pick?
Isolation.
Isolation.
Yeah, I think this is an amazing thing that we're doing here right now, and amazing that it was a little table and now it's this. But when you think about it, how many peer workers are there in New South Wales? There's not enough seats here for everyone. So that needs to change, I think. It's a good start, but let's get bigger. Let's get bigger, because we are bigger and we deserve it. We deserve to have this space. I also think we need to take personal responsibility for our isolation and reach out to each other and try and form community. and be really aware that most of us are impacted deeply by trauma, intergenerational trauma, and all kinds of horrible life events which have led to a place we are now, and invest in considering doing intentional peer support training or doing non-violent communication training, because we can unintentionally hurt each other through the frame of our trauma. And I think there's a lot of unspoken interpersonal violence that happens in peer workforce, and I'd really like for us to think about making our workforce more intentionally non-violent moving forward, so that we can be unified. Because it's like, they say in the union movement, the workers united can never be divided. So let's be united.
Thank you, Jemima. Chris, which one did you go for?
The LHD to CMO.
Oh, excellent, because otherwise I was going to have to do another round to cover that off, so good job.
I thought I'd
right, yeah, great.
I think, especially with this year, having the CMO peer workers being welcomed into this space, and we're very, very happy to be here. It's awesome to come together as a profession, yeah. And I think there's obviously different particular things that affect each sector, but there's also a lot of more things in common. So I think when we are able to come together and talk about challenges or wonderful things that are happening across the profession, that brings us closer together, but also making sure that we have appropriate things put into place, opportunities to have conversations about the particular things that happen within our sectors as well, because we all have different challenges that might equal the same sort of outcomes, but they're for different reasons. Yeah, so I think it's really important to be aware of the nuance within that, and have opportunities to talk about it and have them considered. And I think we need to be able to also educate each other. I mean, I was having a conversation with Ryan last night, and it was about what does peer work look like in different places? Because it does look different, and as we become more specialised in different things, the work is a bit different. The work evolves. Things look different in community outreach than it does in inpatient units or in safe havens, or that we're able to apply the same values and practices but in different spaces, and it just opens up the opportunities that peer work can bring, and then we can continue to evolve it. So I think the education across the board is really important as well.
Thank you, Chris. So we're on to some of the Hoover questions that have been voted up, and they're definitely getting tons of votes here, so we've got lots of enthusiastic questions for you, and we've got about 5 minutes left, so if you're sort of thinking about that, maybe snappy. The ones that are coming through on the top ones here at the moment are changing the mindset of clinical staff, which we've sort of covered off a little bit with your answer, Ryan, so I might just move on from that one. The next one, the highest one, is around pay rates. Is that surprising? Yeah, shocked by that one?
I actually looked into pay rates across. I was thinking of how could we pitch even locally for people to get more money, and I looked at all the different awards available, in the CMO sector, the SCADS award versus HEO, versus what they're doing in Victoria versus what they're doing in Queensland, and it works out most people get about maximum $35 an hour, which sucks if you're just starting out as a HEO, because that seems like a lot more money than you're getting. But then if you stay and work, you'll eventually get much more than you would in the CMO sector. So, and that's without really having to perform. Just come to work. And time ticks on and you get more money. So I don't know, it could be throw eggs at me. I think it's actually not that bad. But I'm happy to hear more from other people.
Ryan, you want to comment on that one?
Sorry, I feel like I want to comment on everything. But look, I think that's a good point, because we use the HEO scale, but also the HSM scale. And I think, for example, peer workers in the public sector maybe start up at, say, about 50K and can go up to 110K, can go up to 130K in regards to some roles. And I think, when we were talking with CMOs in relation to that, it's, as you said, Jemima was saying, with the HEO scale, you can go all the way up if you're on a grad rate or a non-grad rate. What's really important is, what does your area classify as grad or non-grad? That's a really important, crucial debate. And when you answer that and you can change that, then it can make a 8-9K difference in regards to your roles. I'm not aware of the CMO scales, but I don't think the CMO scales can go up that high for particular roles either.
After past $35, you have to have a degree. Yeah.
Thank you. I'm going to move on to this one, which is quite thoughtful. It says it's all too common for peer workers to start working with no peer work experience, no peer colleagues in their role, and very little support. What can we do to change this and better support new peer workers? I think it's a really important question. So new people coming in who don't have the supports around them, what can we do? Chris?
I think we just touched on a lot of those in the talks and things like that, about having that consistent support initiatives and development initiatives, become a staple in the industry rather than, non-equitable access or funding and things like that. It should be, part and parcel with, you start as a peer worker, here are the opportunities that you have for development. Of course, there's a lot of complicated sort of things that come along with that, and it's a journey. But I think that's the world that we kind of need to end up in, for people to not end up in those situations, because then people they leave. They get put in situations where vicarious trauma or trauma can happen. There's lots of different things that can leave people vulnerable, and it goes against what we're trying to do in building as a space.
Did you want to chip in as well, Jemima?
Oh yeah. I also think the pre-COVID and when they had partners in recovery, remember those days? Before they took them away. Me and Travis, who's here, did this thing called Partners for Change. I think it's a really cool idea, but I want to get back to it and do it again, but also steal it. We met LHD person with the CMO person and had a meeting once a month at the town hall where we just did a topic on peer work and invited anyone to come. Just to any consumers, anyone who wants to be a peer worker, anyone who is a peer worker, who wants another friend, just little things like that, build community. We can't, also systemically they should provide for us. I agree.
Evelyne, Ryan, I might just go down the line with this one. Have you got something to add there?
Absolutely. I think induction, onboarding, mentoring, budding systems are really important for new peer workers. It is not just peer workers, and it's not just this industry, it's every industry. So how do we get better at that pre-entry level support? I always, if people ask me about coaching and, how can I get into this field or what can I do? It's as soon as you show an interest, start volunteering somewhere. Get in, start volunteering in some capacity. And I know that I'll be telling my two boys, and I already am, to say, what are you interested in? What do you think you're going to like? If you want to be a lifeguard, then start swimming and start getting into, getting to meet the teachers. Whatever it is you want to do, start doing it. And I know that that's what I did at uni. I held down 3 jobs while trying to do 2 degrees while at uni, just because I knew that by the time I finished my 3-4 year degree, I was going to be, have a head start. So maybe in the peer workspace, what we need to be doing is working with consumers in the programs that we're delivering to say, there's this pathway called peer work, and just plant the seed so that, in time to come, that might be something that, a percentage pick up. So, we talk about early intervention, we can talk about early knowledge and getting that information out there quickly.
Thank you. And Ryan?
I think this is actually a huge gap, because sometimes when peer workers come into the space, by the time they actually start, for example, a cert form might take, say, 4 months to get into it, and they start it, and it might take a year to complete. So to actually complete that qualification takes a year and a half. What are you doing in the meantime? So as a result, what do you actually use as a result? And I was talking to Chris before, and Chris actually developed this really interesting 2-day training for people when they come into the service to actually understand what peer work is, a bit of a crash course for peer work. And I think that was quite powerful, and I think a way we've probably appropriated that in a similar way is we have that regional peer framework. And so when I had a new peer who joined, they actually said, what does peer work involve? We actually went through that framework page by page and went through different parts of it and talked about what does mutuality actually mean? What does reciprocity actually mean? How do you actually use that? How are you a role model for hope? What are you curious about? Are you aware of inpatient units? Are you aware of the Mental Health Act? Do you understand what seclusion restraint is and how ways we can overcome that? And you start going through, but you realize there are actually quite a lot of gaps that exist overall. And I think there could be a lot of good opportunity to look into how do you actually help to create dedicated training which can be used as an option, but also at the same time, to be honest, it takes a lot of self interest as well to look into that, because sometimes you've got to hunt for that information. This isn't easily available, but that's where I said speak to your colleagues and speak to others, have good mentorship, have good supervision, have good co-reflection, speak to other people who will actually contribute and tell you some of that information which you need to get past particular points. And then you've got amazing systems like the Cert 4, the Fast Track, different options which will actually give you that experience, local groups, tapping into knowledge from others, and peers can support one another in that space. So those are some options in the meantime, but definitely some opportunity for future investment.
Just got to geek out with it. Just geek out with peer work.
Thank you.
Helen,
so we're going to congratulate our panellists and those who haven't managed, those who haven't, well done guys. Yes.